Hey everyone, I'm Dr. Jesse Ehrenfeld. My pronouns are he, him, his, and I'm a physician with expertise in LGBTQ+ health and the immediate past chair of the American Medical Association. Today, I'm going to answer your questions about the COVID-19 vaccine. I know there's a lot of information circulating out there that can be confusing, especially now that it's open to teenagers. Hopefully, I can help clear up some things for you. We've got some great questions from the It Gets Better Project's Youth Voices. Let's go ahead and hear the first one.
So I wanted to know, is it safe for a teenager like me to get the COVID-19 vaccine?
What a great question to start us off with. Yes, the safety profile is similar to that of adults. It is now recommended that everyone 12 years or older receive the vaccine for COVID-19. Millions of people in the US have received COVID-19 vaccines, and about half of the US adult population are now fully vaccinated against the virus. Both established and new safety monitoring systems are being utilized to make sure that the vaccines are safe. You might remember that pause in the J&J vaccine. That's an example of our extensive safety monitoring systems working, identifying even a small number of cases and examining them closely. Remember, you can't get the COVID-19 disease from the COVID-19 vaccine.
I also wanted to know, what are the most common side effects of getting this vaccine?
I've been asked that question so many times. Potential side effects appear to be the same for adults and for children over the age of 12. Side effects are normal signs that your body is building the protection that you need. Common side effects include being tired, having a headache, achiness, or chills, and they may affect your ability to do daily activities, but all of those things should go away after just a few days.
So is like one vaccine better than the other? And if so, which one should I get?
This is another great question. All of the FDA-authorized vaccines for COVID-19 are safe and effective for adults. The Pfizer vaccine is safe and effective and has been authorized for children aged 12 and older. Now, patients, particularly women aged 18 to 49, should be aware of rare clotting events that have occurred with the J&J vaccine, but as well as the availability of alternate vaccines to guide their decision-making process. Now, the AMA has joined with the CDC in recommending those eligible for the vaccine receive whatever is readily available to you.
What advice would you give a kid that wants to get the vaccine, but their parents aren't too fond of the idea?
This is a tough one, but an important question. Generally, for a minor to receive healthcare services, a parent or a legal guardian must give consent. However, whether a child can receive a vaccine without their parents' permission is actually dictated by state law and does vary by jurisdiction. Sharing information with parents on the risks and benefits of the vaccine may be helpful, as many believe kids aren't catching COVID-19, or if they are, aren't having severe outcomes. What's happening though is with more and more adults getting vaccinated against COVID-19, actually children and teenagers are an increasing segment of hospitalizations for the virus. Over 1 million 16 and 17-year-olds have already been vaccinated, and there have been no safety concerns. In addition to the millions of 16 and 17-year-olds that have already been vaccinated with Pfizer, Pfizer has enrolled 2,300 12 to 15-year-olds in a clinical trial. The FDA has issued an emergency use authorization for the Pfizer vaccine for that age group. Moderna has also been studying 12 to 15-year-olds, and in their media release notes that they have had 100% effectiveness in the 12 to 17-year-old age range, and we expect Moderna to apply for authorization for their vaccine soon. Kids now account for 24% of COVID-19 cases in the US. Over 3.8 million children have tested positive for COVID-19, and we know there were likely many more that were not tested. Unfortunately, also at least 300 to 500 kids in the US have died from COVID-19, which is comparable to the deaths that we see from influenza, chickenpox, measles, other diseases for which we regularly vaccinate individuals. Finally, I'll just add that multi-system inflammatory syndrome resulting from a COVID infection should be a concern for all parents. This typically prevents in asymptomatic kids about a month or so after the initial infection and can present as damage to multiple organs like the lungs, the heart, kidneys, etc. And we also know that COVID-19 can cause serious secondary issues like vasculitis even in children.
So if I'm vaccinated, but the other kids that I go to school with aren't vaccinated, am I safe?
This is a real issue that a lot of kids are struggling with right now and will continue to struggle with in the fall when we go back to school. The risk of having a severe reaction to COVID-19 or dying as a result of the virus is very rare for those who are vaccinated. Those who are not vaccinated should continue to abide by safety measures that we know are effective in limiting the spread of the virus. Wearing masks when outside the home, washing your hands, and maintaining a safe physical distance from others. According to the American Academy of Pediatrics guidance, schools, childcare programs, and camps are all encouraged to continue to support the use of face masks for children and staff until the vaccine is available for younger age groups and vaccinations within the pediatric population are high enough to prevent transmissions of the disease.
Are there any situations in which you'd recommend that someone not get vaccinated?
This is a great question. There are a number of people who may have allergies that should be taken into consideration before they get the COVID vaccine. And if you're in that group, you should always consult with a physician prior to receiving your first dose. For people with that contraindication or precaution, referral to an allergist immunologist ought to be considered. For more information, you can see the CDC's interim clinical considerations for COVID-19 vaccines. Now, what are those contraindications or precautions? They include having a severe allergic reaction after a previous dose to the COVID vaccine or a component of the vaccine, or an immediate reaction when you've had a previous dose of a known component to a different vaccine with the same components. Polyethylene glycol is an ingredient in the mRNA COVID vaccines, and polysorbate 80 is an ingredient in the Janssen COVID-19 vaccine. Both of those are structurally related, and they can have some cross-reactive hypersensitivity between those compounds. So, among people who received one mRNA COVID-19 dose, but for whom the second dose is contraindicated, what you can do is potentially get the Janssen COVID-19 vaccine at least 28 days after your first dose.
Kind of similar to the flu vaccine, are we going to have to get vaccinated again next year?
That question shows a lot of insight. We don't know that yet, as scientists and researchers are still studying the durability of protection against known variants. But there is a likelihood that a booster will be needed at some point to target new variants that might arise in the future. Stay tuned.
Data shows that communities of color and LGBTQ+ people have been disproportionately affected by COVID-19. They're also not getting vaccinated as quickly. What are some ways that we can help?
I love this question. It's so important that we all work together to make sure that everyone in every community that wants a vaccine for COVID can get it at no cost. For those who can receive the vaccine but are reluctant to, for whatever reason, physicians can play a really important role as trusted advisors and counselors. Even for people who may distrust medical institutions or the healthcare system at large, they still tend to trust their personal doctor. So look, all of us need to be working within our own spheres of influence to answer our friends' questions, address their concerns, and build confidence in these vaccines.
Many LGBTQ+ youth don't have reliable access to healthcare. What are some ways that they can get the vaccine?
Thanks for asking about this. Whether or not you have a personal physician or even health insurance, you are eligible to receive a vaccine for COVID-19 at no cost. I encourage anyone who wants to receive the vaccine to contact their local health departments or to ask a physician in their community where they can get it.
The CDC says that once we're fully vaccinated, we won't need to wear masks in most places. Do you think there will come a time in the future where we'll have to wear them again?
Again, this is a really important issue that's on many people's minds. This depends entirely on if and when we see COVID surges in the future and how the new virus variants evolves. The most important thing we can do to prevent these scenarios from occurring is to encourage as many people as possible to get the vaccine today.
How would you suggest talking to someone who doesn't want to get the vaccine about why they should?
This is another tough one. Talking to someone who doesn't want to get the vaccine is hard. It's important to understand their concerns and to answer their questions honestly. There is a tremendous amount of misinformation and outright falsehoods about the virus and these vaccines circulating online. As physicians, we have a responsibility to counter this misinformation with credible science and evidence whenever we have the opportunity to. The fact is, COVID-19 remains a serious threat to public health for anyone who is not fully vaccinated, and we just can't lose sight of that. That's all the questions we have. I hope I was able to clear up some things for you. As always, let's work together to keep our LGBTQ+ community safe. And for the latest COVID vaccine updates and guidance, check out the American Medical Association website, where you can find free online daily COVID-19 video updates. Thanks and stay safe.